during the depolarization phase of an action potential, is the membrane more permeable to sodium or to potassium? What about the repolarization phase? Oh, I think we discussed these already. Hang on. Okay, I'm seeing some responses coming in. Yes, so it's going to be more permeable to sodium during depolarization and to potassium during repolarization. Excellent, but I think we discussed these already. Did we? No, we did not. I think we discussed some similar questions. My bad there. So yes, these responses are correct. Sodium is going to have a higher permeability in depolarization, and then potassium will have the higher permeability for repolarization. All right. Question 2, compare the gating mechanisms of the voltage-gated sodium and potassium channels. Why is the timing of events so critical to the development of an action potential? So why is that timing so critical? All right, so the timing here, we mentioned that it's critical to synchronize the events, right? To synchronize the events in terms of what's happening with sodium channels and potassium channels, also to time the entire action potential. The action potential lasts about 1 millisecond. And so having that timed component on the gating, right, making sure that it's going to inactivate the sodium inactivation gates after 1 millisecond. Also, that the potassium channels are going to be activated after that same 1 millisecond ensures that 1, this action potential will only last that amount of time, but also 2, we synchronize the events on both of these channels to help encourage really the change of the membrane potential, especially at the peak of the action potential. All right. Question 3, during which phase of an action potential are the sodium channels closed but capable of opening? So in which state are sodium channels closed, but they can be opened if a strong enough graded potential came along? Okay, so relative refractory period in hyperpolarization and open during depolarization. So yes, this is correct. The channels will be open during depolarization, right, which is kind of the second prompt here in the question. The first one is going to be at rest or again in that relative refractory period. Absolutely correct. So at rest / relative refractory period, we're going to see the sodium channels closed, but if we had a strong enough graded potential, they are capable of opening. The third prompt, during which phase are they closed and incapable of opening? That would be the absolute refractory period. Okay, also the repolarization, right? Remember the downstroke of the action potential, which leads to the absolute refractory period. In those instances, we would have the sodium channels incapable of being open, specifically because the inactivation gate is also closed. All right. Okay. All right. Okay. So any questions on these? Okay, let's look at the additional set here. So these additional checkpoint questions. All right. Question 1, can an action potential be generated during the absolute refractory period? And then the second prompt, can it be generated during the relative refractory period? So what are our thoughts on this? When can a new action potential be generated? Okay, excellent, right? So no for the absolute refractory period. In other words, the channel is closed and incapable of opening. So even if we had a really strong, what we call a supra threshold graded potential, we would not be able to open up those channels. We would not be able to generate a new action potential, but we can for the relative. As is mentioned here, if a strong enough graded potential came about, it would have to be stronger in order to generate a new action potential in the relative refractory period. The reason here, right? So the reason for the absolute refractory period is that the sodium channels are inactivated, so it's impossible. In the relative period, the potassium channels are still somewhat open. They have not all closed yet, so there's still more potassium inside that needs to leave. So it's going to take a stronger graded potential to generate a new action potential here. All right, question 2, during the absolute refractory period, are the majority of sodium channels open? Are they closed but capable of being open, or are they closed and incapable of being open? So what is the state of the majority of sodium channels in the absolute refractory period? Okay, again, excellent. Yes, so they are all, majority of them are closed and incapable of opening. All right, closed and incapable of opening. Okay, any questions from these items? Again, these are all similar types of concepts that will be tested on the exam. So make sure you understand what's happening, absolute versus relative, and the why, right? So the absolute is going to be really owed to sodium, the state of the sodium channels. The relative is going to be owed to what's happening on potassium channels. Okay. Last couple of review points here. Let's look at the polling questions. So again, I covered all of this as far as the last objective here in the video from last class. If you missed it, please go back and watch it. Here we looked at myelination, saltatory conduction, and how the action potential jumps down the axon. So if you haven't reviewed that, definitely go back and watch it. Let's look at some of the poll questions here. And I apologize, my camera keeps shutting off. I think there's some type of short in the connection. I promise I'm not trying to ghost you guys here. Okay, so let's launch a poll and look at some of these questions. All right. All right, okay. Okay, so an action potential either fires or not, all or none, and it maintains its strength as it travels. How does a graded potential compare? Let's see, most of you went for C. C says it is weak depending on the stimulus strength and dissipates away from the stimulus. All right, so C sounds correct, and it is, okay? If you look at some of the other distractors, I think some of you went for D. It is weak, which is correct, depending on the stimulus strength, also correct, but maintains its strength as it travels. So that last part is not correct, okay? We know that the graded potential dissipates or weakens in terms of the strength the further away from the source that it moves, specifically the further along the soma that it moves. Option B, it is all or none. That's not true, right? That is a feature specifically for the action potential, but weakens as it travels. That part is true as far as the graded potential is concerned. And then A, we know, is not true. A is exclusively for the action potential. It is all or none and maintains its strength as it travels. Okay, let's look at two more. Okay, let's do 20 more seconds. I see some folks haven't responded yet. Let's do another 20 seconds. All right. So an action potential travels all the way down an axon. Where does a graded potential travel? Most of you went for B, dendrites, cell body, and sensory receptors. B is correct, so that's going to be the proximal part of the neuron. A, synapse, hillocks, and terminals. Totally incorrect, right? Graded potentials do not go past the axon hillock, certainly not towards the terminals, the axon terminals, or even the synapse. C, all the way down the length of the axon, also incorrect. Again, graded potentials do not go past the axon hillock. And then D, nowhere, graded potentials do not travel, obviously also incorrect.